My name is Jen Watts. I am a pediatric respiratory therapist on a neonatal pediatric transport team. I've actually have a little bit of a new role these days. I'm actually the clinical education specialist for the pediatric transport team, but I do still have time that I spend on the ambulance. I've been doing transport for 15 years now. I've been a respiratory therapist for almost 25 years. So I definitely have gone a journey of some adult care and then done a few different things in adult care and then went into pediatrics. And once I started in pediatrics, I definitely have found my love. Well, transport was something I really didn't have much of an idea about before I started pediatrics, that respiratory therapists would be able to be involved in that type of an atmosphere. So when I started working at the Children's Hospital, I actually met the transport team and kind of got to know a little bit more about them. And in doing so, it became one of those things. This is one of the things I want to aspire to do. And I think that has a lot to do with moving on as far as progression of critical thinking and moving on in the profession itself. So I kind of fell into becoming part of the transport team. I was working as a pediatric respiratory therapist. I was in an ICU room doing some therapy with a child, and a couple of the transport team members were walking by, and I hear there she is. They come back to the PICU and into the room, and they're like, "Hey, Jen, so there's a position opening on the team. We think you should really apply for that position." And it kind of took me aback because I didn't think I was ready to go down that road yet. I thought I still had a few more years in pediatrics to actually get under my belt before I took that next jump, that next leap. But this is also a time with the particular transport team that you had to wait to a point where someone left to be able to be part of that team. So if I didn't take advantage of that opportunity, it could have been another 5 years before someone left a position open where I could hopefully step into that next role. I did. So in our particular, as far as our scope of practice of what we have for respiratory therapists in the state of Illinois, at least in the northern part of the state of where I work, we really don't have the autonomy as far as being able to place advanced airways or to do peripheral IV sticks, those types of things. So I definitely had to spend more time in the operating room and get exposure and become proficient in placement of advanced airways. I became more proficient in placing peripheral intravenous catheters. We definitely also extended our training to performing needle decompression. We also train in needle crikes, and we also are quite proficient in placing IOs, which some of these things we don't necessarily practice on a live patient, but we do have cadaver labs that we have participated in to get those proficiencies and maintain those competencies. So I definitely have more training that I have to maintain as a transport therapist than I did as a pediatric respiratory therapist, strictly on the units. There's really no extensive training that goes along on the physical aspect of it in our program. We do have to maintain a fitness for duty, so that does mean we do have some tasks that we need to be able to complete without having issues. We need to be able to lift so many pounds of weight and maneuver with that weight without having any negative body mechanics or causing ourselves harm or patient harm. So there really isn't, I can't really say there's something in writing as to the difference in physical fitness, but you have to show that you are fit to perform the job on a yearly basis. The RT role in transport is more of a collaborative role. Our particular transport team is comprised of a pediatric nurse and a pediatric respiratory therapist, along with our paramedics that join us through our vendor. So as far as that partnership and that difference in respiratory care and transport, I would say you have to be more on your critical thinking game, taking into consideration the what ifs of what could happen on that transport, what could go south on you very quickly, that you have to be able to respond just as quickly to be able to provide appropriate care. And having that collaborative partnership with your nurse, it definitely opens up the realm of possibilities of how you can work off each other and help provide the best possible care and safest possible care for the patient. So I think it's definitely something you have to be able to work well with others to be part of the transport team, not just as a respiratory therapist, but it also goes for nursing and paramedics and that type of thing, because when you're in the field and when you're on that call, it's you guys are each other's lifelines, wingmen per se. So being able to critically think and collaborate in the critical thinking is an essential part of being part of transport. I think it definitely falls into the area of where you work. I mean, there are some RTs that are on transport teams for adult care, some RTs that are on transport teams, as I am, for neonatal and pediatric care. I think as far as the job security, I won't lie, there have been times where I've been drawn to question as far as, are we valuable to that team? And if I start to think that something happens where the medical control physician or one of our medical directors validates that we are an essential part of the overall care for these patients. We're an essential part for that, as I was saying earlier, the collaborative care. Some things I think of, my nurse doesn't necessarily think of, or some things that my nurse thinks of, I may not necessarily have thought about that, but I'm the one that can put those actions into gear and have that plan of care come into fruition as far as how we want to treat that patient. So the more, I would have to say, as far as being part of that niche, that specialized niche as far as transport, we're definitely very important to that the child's care, safe care of a patient, be it a child or an adult. As far as security, I think the more that we prove to our patients and prove to ourselves that we have the critical thinking aspect so well under our belts, that we're such a part of a fine-tuned machine, I don't think the security of where we are should be ever come into question. It's unfortunate, some of the things that we walk into as a transport team when it comes to care that's given to the children that we take care of. Whereas emergency rooms that we go to are mainly adult emergency rooms that are very well versed in taking care of adult patients. Children aren't little adults. They have different needs as far as their care. So sometimes yes, that emergency room is providing excellent care, it's excellent care for an adult, not for that pediatric patient. So I would say that making a difference as a transport respiratory therapist in pediatrics is hands down not a question that there's a difference that's made by us because of our specialty and being able to respond to the child's needs and the type of care that that child needs. I would say that even as an adult therapist, I would venture that my adult counterparts have the same type of feeling as far as their specialized care that they are able to provide, their critical thinking and their advanced autonomy in their line of practice. They walk into similar situations, maybe not necessarily to what I walk into, but similar in some aspects as far as lower levels of emergency rooms that they need to take care of that patient and get the patient proper and safe care. Oh, this is a tough one. I mean, I'll say this is a tough one because I can think of different aspects of different things that I've done on transport, different patients I've taken care of, because I've had a couple patients that I have transported multiple times because of chronic issues, be it chronic asthma or chronic heart defect of sort. I think as far as more of there's one that's kind of a little more on the, not necessarily the heartbreaking side, but it's more of helping parents being able to get through a difficult time. Where I had a patient that from the day that the child was born, I transported that child the day he was born from the outside hospital to our hospital. And he became one of our chronic patients that we took care of for a couple of years. But during that couple of year time, I myself transported him easily 7 times within his short life. And the last time I went to transport him, it was a bittersweet moment. It was bittersweet in that, unfortunately, the little boy did pass away. However, the parents were there, and it was, I really truly believe that it was the presence of us as a transport team, myself and the nurse that was with me, that helped the parents make the decision and accept the outcome as to what was really going to happen if we were there or not. It made it easier for them to say, these experts that have been taking care of my son for so long truly believe that these are the final hours and these are the final minutes, and it's okay for us to say, stop, we need to let him go. So that was, I would say it was more of the allowing parents to be comfortable in the decisions that they make, because the experts are there at the bedside with them. So that's one of the first ones that comes to my mind. The second one that comes to mind is I have I've had an asthmatic teenage boy that I'd taken care of. I probably transported him easily 3 different times in his lifetime. And the first time I transported him, he was bad enough to the point that he was a big teenage kid. So the adults decided they were going to put an advanced airway in him. They were going to intubate him in his asthma episode. So of course we had some challenges there with him, taking care of him with his appropriate treatments. The next time I went to transport him, he didn't wait as long to come to the ER. We put him on non-invasive ventilation and such, and because it was a longer transport, my partner and I would have time to talk to this young man from hospital A to hospital B, and get to really know him and kind of understand a little more about his life dynamics and challenges that he ran into. And over the course of the times that we transported him, even though we transported him, the last time I transported him, prior, and I haven't seen him since. I think he's probably too old to be transported by peds now, I think. But the last time I saw him, he looks at me, he's just like, "Jen, man, I didn't think I was going to have to see you anymore." I said, "Dude, this time you're not on all the stuff that you normally are on when I come to pick you up. You're on minimal things, but they want to get you out of here because you've had so many admissions to the ICU. They don't want to keep you here. It's just precautionary. It's not because you did anything wrong." His asthma care got better along the way because of having the exposure to us as that entry point into the pediatric hospital and into the asthma education, because he had us with our critical thinking skills and our expertise to start putting those seeds of thought in his mind of what can he do better, or is there anything that he can do to prevent from getting so sick before he actually sees us and enters the hospital. So I have it from both sides as far as those bittersweet moments, but then those happy moments of seeing, yes, there's been a progression in the patients I've helped take care of, even though I only see these patients for maybe 2 hours of their life during that transport time. We definitely make a difference with these kids, and even with our adult patients, I argue that we make a difference. Oh, as far as becoming part of the respiratory therapy world, I would say that options as far as specializing the route of care, type of patients you want to take care of or what you want to do are definitely much more open than they were 40 years ago, even 20 years ago, really. I mean, but if you're not quite sure what you want to do and you think you know a little bit about something, that's kind of how I fell into respiratory. I'm an asthmatic that thought, okay, I'll do this until I figure out what I want to be when I grow up. Haven't grown up, still a respiratory therapist 25 years later, so obviously I chose the right route. But that aside, if you know something, a little bit about something, don't think that it's just one aspect. There's so much more to what we do as respiratory therapists than give a nebulizer treatment to an asthmatic. We are those cardiopulmonary specialists, so we know more as far as the interactings of how we're the specialists in a small area, whereas we know a lot of stuff about a little area, whereas other caregivers need to know a little bit of stuff about a lot of things. So to focus on one aspect of the human condition, I would say a respiratory therapist would be a great way to go about entering into that healthcare field, into that ring, but also having the ability to specialize in pediatrics, to go into transport. You can be an asthma educator. You can work in pulmonary rehab with older adults, COPD care. You can do stuff as far as in the ICUs in post-heart patients that need addressing as far as their respiratory concerns. I mean, even in this time and age, as far as the different things that we've found with how healthcare relies on our respiratory therapists, just over this past several months, our respiratory therapists have been shown even more so. We're in the spotlight of we are an essential part of overall patient care, especially when we have diseases like COVID-19 that affect our respiratory systems. Whereas we may have been an unsung hero at one point, we definitely have the skills, have the knowledge, and even have the critical thinking abilities to be able to meet the needs of the patients in specialized areas.